Hello, my name is Jones Moon and today, we look at Ophthalmia neonatorum. Ophthalmia neonatorum is a form of conjunctivitis that affects the newborn babies within the first 28 days of life. The baby's eyes are contaminated in the colonized birth canal of the mother by Neisseria gonorrhea or Chlamydia trachomatis during delivery. Ophthalmia neonatorum is a severe condition affecting the neonate's eyes in which there is inflammation of the conjunctiva, the membrane that lines the eyelid and the exposed part of the eye, usually caused by Chlamydia trachomatis and Neisseria gonorrhea, characterized by irritable red eyes, swollen eyelids and purulent eye discharge manifesting within the first 28 days of life. There are several possible causative organisms, but the most common are Chlamydia trachomatis and Neisseria gonorrhea. Others may include Staphylococcus aureus, Escherichia coli, Pseudomonas, Haemophilus influenza, herpes simplex virus, chemical irritants, etc. The predisposing factors are 1. Traumatic deliveries, 2. Premature rupture of membranes, 3. Maternal infections, STIs, 4. Lack of antenatal care, etc. There are two major types of ophthalmia neonatorum: 1. Infectious septic ophthalmia neonatorum, 2. Non-infectious aseptic ophthalmia neonatorum. Infectious ophthalmia neonatorum can be caused by either bacterial or viral infections. The baby gets the infection from the mother while passing through the colonized birth canal during delivery. The subtypes of infectious ophthalmia neonatorum may include: 1. Sexual transmitted bacterial infection. This may include organisms like Chlamydia trachomatis and Neisseria gonorrhea. 2. Non-sexually transmitted bacterial infection. May include organisms Staphylococcus aureus, Escherichia coli, Pseudomonas, Haemophilus influenza, etc. 3. Ophthalmia neonatorum due to viruses. Viruses such as herpes simplex virus type 2. 4. Chemicals cause non-infectious ophthalmia neonatorum. Prophylactic silver nitrate solution is an application used in newborns to prevent spread of infection. Hence, it is this silver nitrate has a tendency to irritate the conjunctiva of the newborn's eyes and can lead to serious form of sterile conjunctivitis due to chemicals. Thanks for listening and keep studying.